Hi everyone, my name is Bryn,
My name's Christina.
and our presentation is on spinal cord disabilities. So, what is a spinal cord disability? The definition is spinal cord disabilities refer to the impairments that are resulted from damage to the spinal cord. This can lead to varying degrees of motor and sensory dysfunctions. Many of these disabilities are caused by traumatic injuries. An example could be a spinal cord injury due to a car accident. It can also be caused by non traumatic injuries, for example, by spina bifida or multiple sclerosis. Spinal cord injuries interrupt the communication between your brain and your body. This causes paralysis, loss of sensation, and autonomic dysfunction.
We can break down spinal cord injuries based on its severity, level of injury, the cause of the injury, and the functional impairment. There are two severities of spinal cord injuries. There are complete spinal cord injuries, which is a total loss of sensation and motor function below the level of injury, which means that no voluntary movement or feeling is experienced in those areas. So a person with a T6 injury would have no function below the chest. There are also incomplete spinal cord injuries, which is the partial loss of functions in the body with some motor and sensory abilities. An example of this would be an incomplete C5 injury, which may cause no leg movement but allow arm movement. The spinal cord consists of four sections: the cervical, thoracic, lumbar, and sacral. The cervical spine affects the arms, hands, trunk, legs, and often has an effect on breathing function. The thoracic spine affects the chest, abdominal muscles, and legs. The lumbar spine affects the hips, legs, and partial foot function, and people may require braces or assistive devices for walking. The sacral spine affects lower body function, including bowel and bladder. Some people still have the ability to walk with a spinal cord injury. Each section of the spine affects a level of spinal cord injury and the groups of nerves which have been affected and will have an adverse effect on the body. Traumatic spinal cord injuries are caused by a sudden trauma, such as a car accident, a fall, or a sports injury. A non-traumatic injury is caused by medical conditions such as spina bifida, multiple sclerosis, cerebral palsy, tumors, cancer, or infections. Quadriplegia affects all four limbs and the torso and typically occurs from cervical spinal cord injury. Paraplegia affects the lower half of the body and usually results from thoracic, lumbar, and sacral injury. Triplegia affects three limbs, such as both legs and one arm, and it often occurs from incomplete spinal cord injuries or stroke.
And then going more off of what Christina just said, the movement characteristics of individuals with spinal cord disabilities depends on the level and severity of the injury. So paraplegia is an injury at thoracic, lumbar, and sacral levels, which is T1 to S5. And this is when an individual typically experiences loss of movement and sensation in their lower limbs. Their upper body tends to function intact. This individual may use a wheelchair or assistive devices for mobility. Tetraplegia is an injury at cervical levels C1 to C8. Individuals experience partial or complete loss of movement in both of their upper and lower limbs. Individuals may have limited hand function and may require assistive technology for mobility in everyday daily tasks. Breathing difficulties, especially with injuries at C3 and above, may require ventilator support. Quadriplegia is the paralysis of all four limbs, both arms and legs, and often the torso. It typically results from damage to the spinal cord, usually in the cervical neck region. The severity and extent of paralysis depends on the level and completeness of the spinal cord injury. And then also, spasticity and muscle weakness is when some individuals experience involuntary muscle contraction or muscle weakness. This affects their ability to control their movements. And lastly, impaired impaired balance and coordination is due to sensory and motor deficits. Individuals often struggle with maintaining posture and stability, especially when they have to do weight bearing activities.
People with spinal cord disabilities often experience secondary health complications that can impact their overall well-being. These include pressure ulcers, which are also known as bed sores. Pressure ulcers are caused by reduced mobility and lead to skin breakdown and ulcers. Another complication is a urinary tract infection, which is the loss of bladder control, causing the incomplete emptying, which increases the risk of infection. Bowel dysfunction is another complication which leads to constipation. Respiratory issues can be caused by cervical injuries that may impair breathing muscles. This can increase the risk of pneumonia and respiratory infections. Due to reduced weight-bearing activity, bone density is lost, causing osteoporosis and increasing the risk of fractures. As previously mentioned, spasticity is uncontrolled muscle spasms, which can cause movement difficulty and muscle weakness. Autonomic dysreflexia is a life-threatening condition where blood pressure spikes due to pain or irritation at the injury site. Chronic pain is caused by nerves or musculoskeletal pain from posture and discomfort. Cardiovascular issues may arise due to reduced physical activity, which increases the risk of blood clots, low blood pressure, and heart disease. Finally, mental health challenges like depression and anxiety are common due to lifestyle changes and physical limitations.
And this is some health and safety considerations that are relevant to physical education. So, if or when someone is designing physical education curriculum or rehabilitation programs, professionals should consider several safety factors. Individualized adaptations is a factor that a professional should consider. There should be activities tailored to an individual's functional abilities. For example, PE teachers can modify sports by using seated exercise or adaptive equipment. An example of this would be incorporating wheelchair basketball for adapted PE activity. Next, thermoregulation awareness should also be considered. Many spinal cord injuries can affect body temperature regulation. This increases the risk of overheating or hypothermia. A professional should make sure there is access to proper hydration and environmental adjustments if it is necessary. Cardiovascular considerations are also something that should be a factor. Individuals with high-level spinal injuries may have reduced cardiovascular function. PE teachers and therapists should monitor heart rate and blood pressure during physical activity. Very importantly, there should be accessible environments. Facilities should have ramps, wide pathways, and adapted equipment to ensure accessibility and inclusivity. Injury and spasticity prevention should also be implemented. Stretching and controlled movement exercises can help manage spasticity. Professionals should ensure safe positioning to prevent contractures and joint injuries. Finally, since individuals with spinal cord disabilities have reduced sensation, prolonged pressure on certain body areas can cause sores. Frequent repositioning and appropriate seating are very crucial.
Designing physical education programs for individuals with spinal cord disabilities requires thoughtful organization and instructional strategies to ensure accessibility, engagement, and success. Designing individualized education plans based on each participant's mobility level, functional ability, and personal goals ensures activities are appropriate and effective, maximizing participation and skill development while minimizing injury risk. Using modified sports equipment, such as lightweight sports wheelchairs, grip aids, and ramps, ensure accessibility in gymnasiums and outdoor spaces, and provides equal opportunity to engage in physical activity safely and effectively. This also promotes independence and confidence. Breaking down complex skills into smaller, manageable steps and providing alternative ways to perform activities allows participants to progress at their own pace and build confidence gradually. Implementing peer monitoring, cooperative games, and team-based activities encourage interaction between individuals with and without disabilities. and it fosters social inclusion, teamwork, and motivation by reducing feelings of isolation and increasing engagement in physical activities. Adapting game rules ensure fairness and inclusivity, for example, lowering nets, adjusting game duration, allowing different methods of scoring, encourages active participation without unnecessary physical barriers. Setting small, achievable fitness goals and progressively increasing intensity or complexity over time builds confidence, maintains motivation. Overall, we would want to promote participation in adaptive sports, community fitness programs, and at-home exercise routines to encourage long-term engagement. By implementing these organizational and instructional strategies, individuals with spinal cord disabilities can successfully participate in physical activities, improve their physical health, and develop confidence in their abilities.
Thank you.